Classification of anti-thyroid drugs. First, drugs inhibiting iodide trapping. Thiocyanate, perchlorate, nitrates. Second, drug inhibiting hormone synthesis. Propylthiouracil, methimazole, carbamazole. Third, drug inhibiting hormone release. Iodine, sodium iodide, potassium iodide, organic iodide. Fourth, drug inhibiting peripheral conversion. Propylthiouracil, amiodarone, propranolol, glucocorticoids. Fifth, drugs that destroy thyroid tissue. Radioactive iodide. If you like the content, please subscribe the channel. Thank you.